Edge bonding. You know how frustrating this is. It's probably gonna break. Let me show you how to do it better. Okay, imagine the scenario. The patient doesn't like the uneven incisal edges on 8 and 9. She wants them longer and more even, but you know that if you just put some composite on there like edge bonding, within sometimes a day or sometimes 2 weeks or sometimes 2 months, it's gonna chip. It's embarrassing for you, it's disappointing for the patient, and it's just something we wanna avoid. So I'm gonna show you how to do edge bonding in a way that lasts. The key to this whole thing is making it thick enough. Remember, composite doesn't get incrementally stronger as it gets thicker, it gets exponentially stronger as it gets thicker. If you have 1.5 millimeters of composite, that is about almost the same tensile strength as enamel. In order to create that, here's what we've got to do. We're going to roll these two tips with the putty matrix. When you look at them from the side, this is what they're going to look like. As you can see, this patient was just slightly retroclined. So what we're going to do is we're going to bring that palatal shell forward. The incisal edge of her natural tooth is already 1 millimeter. This is bringing it forward another 0.7, maybe even almost 1. And then we're going to connect the dots here to make this have a nice profile. That's going to be strong enough. What we've done prior to this, we were able to put the tips on here, but as you can see, she had quite a lot of blue and gray in her previous tooth. What we did is we added the blue and gray here. You can see I've drawn the blue through the corners, the gray here at the incisal edge. It's actually Ivoclar blue and gray tints that we've used. And then we brought that forward. All we need to do from here is add another layer right here and spread this layer towards the cervical. This is Opal from Cosmetic, Opal Microfill. We're gonna spread that Opal Microfill this direction, and that is gonna kind of connect those dots so it looks like the emergence profile is perfect. Once we do that, here's our result. So you can see there's a seamless transition from the Opal Microfill to the tooth. The incisal edges are now even and lengthened, but most importantly, they are thick enough not to break. I've made sure that the occlusion is shared, so both teeth touch as she protrudes forward. It's gonna be a lot less likely to break. She's gonna function on that in that thick sense, and it hasn't really brought her profile up too forward because remember, we only added 0.5 to 0.7 to the front of the tooth. A little bit more flared, but now she's even and it's not gonna break. That's the technique of the week. If you wanna learn more about this, DM the word course. I can teach you a lot about composite resin in the anterior and how to make things beautiful and aesthetic.